Hello everyone, I'm Dr. Deeksha from Obstetrics and Gynaecology Department at Narayana Health. Today we are going live with Dr. Lavanya, who is a senior consultant, a robotic surgeon and an infertility specialist at Department of Obstetrics and Gynaecology at Narayana Health. Madam, today we would like to discuss regarding uterine fibroids with you. So please answer some of our questions.
Sure. I think it's a wonderful topic that you have picked for today, and let me take your questions.
So madam, what are fibroid uterus?
I think you'll have to understand at the beginning itself that you don't have to get scared when somebody says you have fibroid, because fibroid is something which is non-cancerous. And so don't get very apprehensive when a sonologist does your scan and says you have a fibroid, or your gynecologist says you have fibroid. Stay calm with that because it's non-cancerous. It only means that there are a lot of smooth muscles in the uterus. These smooth muscles start becoming bigger and they start becoming a little differentiated from the surrounding area, and they form a firm mass. So this firm mass looks a little different and it can be situated in several places. Quite a few times it can be outside the uterus, it can be inside the uterus. Sometimes it is so much that it can actually block the tubes as well. So it can be in several places, and quite a few times we have seen multiple fibroids of almost 30 as well, and there could be just one fibroid. So number, size, everything varies, and it's just that it is a non-cancerous, so we call it a benign. Of course, there are chances that this benign tissue can become cancerous, but then you'll have to remember that percentage is very, very, very less. And I wouldn't mind saying even less than 0.5 to 1%. So you don't have to be worried when somebody says you have fibroid.
Okay, so ma'am, what are the symptoms which patient comes to you with when they say they have a fibroid? So what can these symptoms be?
I think that's a wonderful linking question to my previous answer. I mentioned to you that the fibroids can be at different locations and different numbers. So it depends on how many number of fibroids you have, where is this fibroid located. Sometimes it can be inside the uterus and we call this a submucous fibroid. So if it is submucous, then you can end up having lot of pain, lot of bleeding. All these things are common. Even sometimes it can be in between the uterus. We call that as an intramural. If that is the thing, then what happens? Again, pain can be severe during your menstruation. Your periods can be prolonged. So it can go on for a week or 15 days, and there can be a lot of irregularity in the periods. So, like you get periods every 2 to 3 weeks once, or you get it more frequently, staying for a longer duration of time. You end up passing a lot of clots. You can also have lot of pressure symptoms, especially in subserous fibroids. So one, the subserous is something which is staying outside the uterus. So what happens if it's a very big lesion? It can compress on the close by organs, that is the bowel or the bladder. If it compresses on the bladder, what happens? You could be ending up having symptoms like difficulty in passing urine, or sometimes even frequent urination, or incomplete voiding could be one of the symptoms. In turn, if it is compressing on a bowel, then you can end up having a little constipation and pain during defecation. Quite a few times, if it goes into the POD, that's we say posterior part of the uterus.
Yes.
Few people do experience having pain while having sexual contact during intercourse and can also lead into some kind of bleeding. Other issue is, worst situation I would say is like it can be a cause for infertility.
Yes.
It is in such a position where it can be blocking the tube, you can end up being infertile. So depends on the number of fibroids you have, depends on where is this fibroid located, and that is how the symptoms can vary anywhere from bleeding, irregular periods to painful menstruation.
What about miscarriages, ma'am?
Yes, definitely. Like I said, again, it is one of the causes where if it is submucosal especially, it can lead into abortions because there's no proper blood supply when the baby gets attached. The implantation happens in the wrong side. So again, abortions are very common. And few times if it's a very big fibroid, it can lead into preterm deliveries. Even sometimes mid-trimester abortions, we call, all these things are common. If there are multiple fibroids and it can cut off a blood supply, this can also lead into IUGR, that's growth retarded babies as well, because of the location of the fibroids.
So, ma'am, how do you know whether the patient has a fibroid? How do you diagnose it?
I would take it as two-part. I would make this question as two-part. How would a patient recognize? How would a doctor recognize? Because it's very important that you try to understand when do you reach to your gynecologist? When do you approach a medical care? So, if you notice any of the symptoms that I've told you, like you have excessive flow, you have very painful periods, or you have a prolonged periods, make sure you visit your gynecologist, get yourself checked so that you know if you're dealing with any abnormalities, is it fibroid or anything else, your gynecologist can definitely help you out. Per se, other than the symptoms, very difficult for you to understand, but then I would say anybody about 30 years, 35 years, better to get your annual check done, and that's always wonderful. When you come to a gynecologist like me, we always do a examination of the patient. Sometimes they reach out to us so late that you can see that the fibroid is grown up. We would always say you're a 5th-month pregnant lady, so it's almost up to the umbilicus level. So once we examine you through the para-abdomen, and we also do a per speculum examination where we examine through the vagina and see is there any abnormalities, how big is your uterus, we do a bimanual examination. This is the part of the examination. Of course, like I said, if you've done a health check, somebody's done your sonograph, that's your ultrasound, or because of your symptoms, we may ask you for ultrasound and scanning can be done. So through this scanning, which is totally a non-invasive modality, and it's very easily done because it would hardly take 5 to 10 minutes for the sonologist to screen your abdomen and say if you have a fibroid or not. Advantages, we also know what is the number of fibroids you have, what is the size of the fibroid, where is it located, and I think that's a very simple investigation that we can do. Of course, we have lot of various other modalities like MRI and all that is required. Only if we're looking at infertility and we want to just remove some things, then we go for it. Otherwise, I think examination will help, and simplest is the sonography that can be done.
Okay. So how do you treat, and more of it, when do you treat a fibroid?
So when do we treat a fibroid? Again, depends on when are you reporting, how much is it causing a problem. If you end up having periods just for a few days and you're just experiencing pain, it can be very well managed medically. We don't have to intervene too much. We can just give some symptomatic treatment like painkillers and something to make sure that she doesn't bleed for excessive day. If this first modality doesn't help, then only we have to start thinking about hormonal treatment, because here we need to understand it's a fibroid, it works or it gets more because of the hormones. So, and most of the times this fibroid is seen in a reproductive age group, and in the reproductive age group you all know that the estrogen and progesterone starts working on the fibroid, they end up having a little increase in the fibroid size. So depending on, is she looking at fertility, is she not looking at fertility, we have to play around a little with the hormones. Definitely, there is a treatment modality available. Depending on the symptoms, we can put you on the injectables, we can put you on the hormones, we can put you on, yes, birth control works very well because that will make sure that she doesn't bleed frequently, make sure that the pain is very less for her. We also have medicated copper T, which we call as LNG IUCDs, which can be used so that she doesn't have to bleed. Depending on her reproductive age group, depending on her symptom, is she looking at pregnancy, definitely all kind of modalities are available, including medical and surgical management that we can always think of.
What are these surgeries, ma'am, which you're talking about? What surgeries are
Yes, surgeries we have several kinds. If you have very less symptoms and if you respond to the medical management that we are talking about, we don't intervene at all. Because here we at Narayana always practice very ethically, and we try to make and treat you very comfortably in such a way that we can send you home with the least invasive methods as possible. But if you are not responding to any of the medical management, or if you're looking at pregnancy, and like I said, if the fibroid is blocking the tube, not letting it grow, or if it is led into previous abortions, if it's led into previous mid-trimester miscarriages, or it is abortions are happening, or she's not able to conceive, or she has severe pain, then we think about surgery. Or she has multiple fibroids, she's completed a reproductive age group, she's above 40 plus, and she's going through a lot of problems. Yes, completed the family. Quite a few times the bleeding can be so profuse that they can end up with anemia. And that is also one of the indications where we do consider surgeries. And if it's only severe, then we intervene and we do a surgery.
So what are these surgeries?
Coming to surgical part, at Narayana, we have all facilities for you. We can do a laparotomy where we open up and then we can do. But we have to remember, we are in the world of minimal invasive era we are. So here we have laparoscopy. We also have robotic surgeries here. Surgeries are considered the highest of the technologies across the globe here. And we're lucky to be working in such an institute where we can offer patients robotic surgeries. Robotic surgery helps the patient in such a way that they can go home very quickly. Even while operating, we can see that the bleeding is so less for the patient and her pain is so less that the patient can start walking on the same day of the surgery, and the stay in the hospital is hardly a day or two and they can go home quickly. And even for an operative surgeon, I have operated uteruses of almost 24, 26 week size fibroids, multiple fibroids where people travel across the globe to come and get operated for the myomas. And like I mentioned, I also practice fertility. To help such patients, we have done several surgeries. They fly back in 4 to 5 days and they're very comfortable. A lot of people have conceived. And so we can do a laparoscopy, robotic, or a open surgeries. So all facilities are available.
So what will you do, ma'am? Will you remove the fibroid or the uterus?
So again, depends on the age group that you are reporting. If you're looking at fertility or you're less than 40 years, we want your hormones to be functioning. If I go ahead and remove your uterus, if you're less than 40, we need to remember your ovarian function is going to come down very quickly. So you will end up having a lot of other comorbidities post-surgery because the estrogen is going to come down. So here we look at your age group, look at the way you are symptomatic, and then we take a decision. Usually younger patients, we try to remove only the fibroid, either through laparoscopy, robotic surgery, or open method. And if you are above 40 years and your symptoms are too much, it is almost leading into anemia, and then your blood flow is too much, you have too much of pain, then we think of removing the uterus.
Along with the fibroids. Okay. So are there any other modalities other than surgical or this medical treatment you're telling? Are
Yes.
Any other modalities for?
Yes. I think it's a wonderful question that you asked, because all of you need to know it is not just the medical and the surgical modality that is available. Here at Narayana, we also do uterine artery embolization, which is another no invasive, I would say, not even the minimal invasive. It's no invasive because you go to the radiology department, we put in coils, we make sure that the blood supply is cut off for the fibroid. So there's no growth of the fibroid happening, hence a lot of symptoms can come back. Of course, there are radio-invasive methods done, but embolization works pretty well depending on the size of the fibroid as well. So you're trying to say that it is okay to have fibroid, yes, because we can treat you very well, and so you don't have to get apprehensive. Like I started my talk by saying, it's non-cancerous.
Yes.
So you can be relaxed. Rest assured that we are here to take care of you. Any problem, you can always approach us, because here we practice as a team, and then we have a wonderful team who will help you with medically, surgically, and intervention as well if required.
Thank you so much, madam, for solving our problems.
Thank you so much.